Dr.
Yes.
Joanne, would you say that this mental health issue is a generational thing? Because during my time, during our
Yes.
time,
Our
we didn't
time.
have this as part of the curriculum,
Correct.
the holistic mental health well-being.
Yeah.
And it wasn't really so much of an issue, or it wasn't even a reason to skip classes. Like,
Yes.
I've been teaching in law school for over 10 years. And it was only in the recent years that I would get sometimes students who miss a class, and if there's a quiz, of course, they get a failing grade if they miss a quiz. But for us before, the only few times that you can probably get an exemption is if you have really sickness that has a medical certificate. But now I've been getting students telling me, I'm sorry I was absent, I had a mental health concern. And I've had friends also complaining that their younger employees would sometimes be absent and use also mental health as an excuse. Is this an observation in your profession?
Yes, in our practice, in my practice personally, yes, I would say that it can be a generational thing. These generations mentioned by ASEC, they belong to the Gen Zs, who are in fact, they are the digital natives. And digital natives meaning they were born literally with social media. They're attached to their phones, their gadgets. So this generation, yeah, it can be a factor also. Just to add to what ASEC Dex mentioned earlier about some of the factors, we've also seen how social media has also had an impact on one's mental health. There were in fact studies done on this among children as early as 12 to 21, and which showed that social media could have been playing a huge role in terms of affecting one's perception of oneself. In fact, there is what we call, attorney, as a social comparison theory, which wherein an individual, a student, may compare themselves to the rest of the highlight reels presented by their friends. So they may have that comparison, which would leave them feeling lonely, feeling sad, feeling, oh, why me? I don't have this, don't have that. So yes, it can also be due to the generation. And but what's good, attorney, I would like to highlight is that they are more aware. This generation,
is aware
generation
also.
Z, in fact, they are more aware of what's happening. They're open to conversations like this, talking about mental health concerns. Studies have also shown that they are the generation who are more aware and more accepting that they may be going through some mental health concerns, and that's why they ask for help. They go to clinics, they ask for help, they tell their parents, "Ma, I need to seek help," and yeah, so that's good. In fact, it's good. So maybe that's also one of the reasons why we get numbers like this, because there's more reporting. They seek help now. The awareness is there, which is also good. That